Okay, so I walk into the exam room, and Justine's already sitting on the exam table. So I'm going to start with her sitting, okay? Just so you guys can see. So I'm going to ask Justine to take off her socks. Why? Because I want to be able to check the dermatomes, okay? So socks and shoes off in shorts. And this is what I ask our athletic trainers, MAs to do when I come into the office, okay? So quickly, I check for, okay, L2, L3, L4, or I could do 4 down here. So let me do it again. L2, L3, L4, L5, S1. Feel good? All right, if there's any type of sensory problem, then I'll take a Q-tip, I'll break it in half for the sharp point. Who used to use safety pins prior to us not knowing that we shouldn't use safety pins? Yeah, all right, so I break a Q-tip in half and I use that as well. And then I'll do my strength testing. So push up against my thumb, L5, push down, S1. I'll do it on both sides, right? Kick out, right? L4, pull back, L5, lift up, L3, okay? Boom, right? If I wanted to go out here, abduct, L5, S1. All right, so you do strength testing. All right, this is what I call the sitting, I call it the slump test. Dr. Luke calls it something a little bit different. What do you call it, reverse? Oh, you call it indirect straight leg raise. We all train differently, but this is what I call the slump test. So I will have Justine, my patient, straighten their knee. Now pull your toes towards your nose. Feel anything down your leg?
A little bit of tightness.
Just tightness, but not like a shooting pain, right? Good. Tuck your chin to your chest. Anything? You doing okay? Now roll forward for me. You doing okay?
Yeah.
Good. So look at this angle. Right? Now, this is a way that you could pull out a malingerer, too. So malingerers don't know about this test yet. Relax for me. Because malingerers know about lying down and then a straight leg raise. But if they have a positive test lying down, but yet I've already done this and they're okay, then that doesn't correlate, right? Think about them lying down, sitting up. Okay, so that's my slump test. Okay? And then you could test vascular. Always important just to make sure that if they have really acute nail polish on their toes, you can't see capillary refill, but other than that, their vascular status. So we do that part. And that's pretty much what I do with them sitting. Okay, so then I'll have my patient next lie down. Oh, God, reflexes. You guys can do reflexes, right? Patellar, Achilles. Okay, we won't do that. Reflexes, that's what I do there. Okay, now she's supine. Let me put this so I remember to do her hamstring. Let's see, you want me to stand here? This side? You want me to fall off the riser? Hang on. Exactly. Good, perfect. You guys can all see the screen okay? This is not Josh's real job, but he's, okay. So straight leg raise. So, and I always do a hip exam as part of my low back exam. I think it's really important. I can't begin to tell you the amount of people that come in after they had knee surgery and knee scopes, and the pathology came from their hip. Or the pathology they've had a hip scope, but the pathology came from their back. So you've got to examine your joints. Okay, so straight leg raise. This is all, you guys know this, right? So leg is where, let's say that Justine says, oh, I have pain right here. Now who carries a goniometer with them and does measurements of joints? You know, I do sports medicine, and I don't even measure the joints all the time, right? So this is my knowledge of geometry, right? So we're at 0 degrees here. We're at 90 degrees here. Look at that. That's fabulous. Good job. Sounds very unusual. And then, so this is 45, right? So you guesstimate, right? So let's say that Justine at 45 degrees straight leg raise has pain that goes down posterior thigh, posterior calf into her heel, okay? Now, I'm going to lower her, I'm going to say, Justine, tell me when the pain goes away. Okay. Then what I'm going to do is I'm going to dorsiflex. And she's going to say, it's back. Does that make sense, right? This is like a neural tension test. So I took off the stress on her sciatic nerve here, but then I added it back in by dorsiflexing. That's just a way to kind of document that, yeah, this is something that's real, okay? All right, that's a straight leg raise. I always check hip range of motion just to make sure we're doing okay from that perspective, all right? Good, all right. It's hard for me to talk and do my exam. So okay, so supine. Hang on for a second. You guys know how you get multitasking and you forget to do something? Oh, you know what I want to show you guys? I want to show you the testing reflex too. Okay, so now, if there's any question about anything, you can always palpate if they're having any other type of symptoms too as well. Let me show you the hamstring. So lie to your left, and we're going to drop her leg down like this, okay? So side lying. So then all I do is I put my finger right on the biceps femoris, so the lateral hamstring, and I'm going to hit my finger and let her hamstring pop on me, okay? Do you have an L5 problem? Just kidding. So you can feel it underneath. So I can feel it underneath my finger, okay, the reflex. Some people really pop up. And Justine, unfortunately, is not that way, but that's okay. Next time, we won't pay you your bonus for doing this because we don't have that. But that's a way you can test it, okay? That's definitely a way you can test it. And the other way you can test it is if I have her go all the way prone. Go ahead. Okay, but then I've got to use my leg. This is another reason, like Dr. Allen, I either wear pants or I wear skirts because a skirt doesn't do it with me being able to do so. And the same thing goes is I'll put my finger on her hamstring and I'll again do this and let her pop. And she is contracting underneath me. I can feel it even though you guys can't see it. Okay, that's another way that I can do it. Okay, so now I have her prone. Okay, so remember we talked about the femoral nerve stretch test. Here's the other thing. In order to preserve your back, your exam table may be this wide or maybe this wide. You want to get your patient moved close to you as much as possible so that you're not leaning in to do these exams because you want to help your own back, right? So here we go. Okay, relax for me. I'm going to flex at her knee. I'm going to extend at her hip and see whether we can reproduce any pain going down her leg. This is also a passive hip extension. You're wanting to try to control it. See how I have my hand here on the pelvis? But she may say, I've got back pain. Correct, right? If we've got a problem with that. And then the other thing is, so Justine, slowly move into, pretend like you're watching TV, like you're a little kid, push up on your elbows. As far as you're comfortable, good. Does that hurt at all? Can you push up any higher? Okay, all right, oh, wow, look at that. Okay, relax, wow. Okay, so that's the active lumbar extension. Just relax for me now, Don. Good. And then when you're palpating, you can palpate central lumbar spine. Remember the top of the iliacrest is at L4-5. Palpate down, get to the SI joints, get to the sacral notches. This is kind of the pathway of the sciatic nerve. Okay? Yeah? Good. All right, go ahead and stand up for me. Now, the same thing goes, and I usually do the gait and my functional testing last. Is this good, Josh? Mm-hmm. Okay. So with my patients, here's the other thing. Gowns are tough. They're really flowy and they're long, and then you can't see their legs and their knees and sometimes like that. So if you can put them in shorts, and then I then will tuck, if they're comfortable, I'll just tuck their shirt in underneath their bra if it's a female. If it's a male, they may be comfortable taking their shirt off, and if not, then we can do the whole pulling the shirt. You guys remember how you did that when you were a kid? Okay. Anyway, we can do that too. All right, so then I look at the posture in general. If we're looking at, no, you're awesome. No, this is good. So now I will look at range of motion. So we talk about range of motion and we talk about lean to the right, so side bend, okay, to the right. And you want a really nice curve without a kink in it. Okay, side bend to the left, and you want to see whether or not they have any pain. Very good. You have them forward flex as far as they're comfortable. At this point, you can just check really quickly to see if there's any curvature in their spine. Come back up for me. There you go. Any pain? And you ask the whole time if they have pain, and then you have them go into extension. Excellent. Good. Now, the other ranges, if you want to check for, is facet is rotation, extension. So you can see how the posterior right facets would be impinging, right, based on the anatomy. Now rotate to the left and extend. All right, good. And we mark whether or not that's a problem. This is your standing one-legged extension. Put all your weight on your left leg for me. And now arch your back for me. And you ask, does it hurt on the left side or the right side or both? And then she would tell you this. And then stand on the right leg, pick up the left, and extend. Okay? You guys can see all the weight on the right is loading more on the lateral right column of the spine. And this is Gillette's test, okay? So let's see if she's got a normal one first. Okay, do you guys even see my posture? Yeah. Right? I mean, I don't want to do this. I'm going to, now my knee, I need a knee replacement surgery soon, Dr. Ward. Because I've had 5 surgeries already, but I'm going to get down as far as I can because I want to make this okay for me too. So left knee up like you're marching, bring it up to 90 degrees. This is Gillette's test. Can you guys see my left thumb go down, come back down, and now the right knee up? Not bad. So my thumbs are rotating down. Now let's say that Justine had a fixed anteriorly rotated joint on the left, or SI joint. She would do this, for example. Okay, does that make sense? So that itself is really valuable to do. Now, I want you to, and then we're going to do the Thomas test because that's hugely great test that I do. So go and walk away from me on your toes. Whoop, sorry, come back towards me on your toes. Turn back around. So just go up on your toes real quick. So she's got great gams, right? They're nice and strong. If you've got someone that's got an S1 problem that they've had for a while, you may see atrophy. This is why it's important to be able to see legs, right? You want to check for atrophy. Now come back towards me and walk on your heels. Okay, if someone's got weakness, foot drop, you're going to see that they're unable to keep that up there. Okay, awesome, good. Now do me a favor, and then I always do single leg squat, that type of stuff too, but come over here. This is a Thomas test. So perch a little bit, now lie down. Perfect. She's going to hug her knees to her chest. Can you, you may need to come over here, young man. Well, no, do this first. That's good. Okay. So Justine is going to pull her knee to her chest, and she's going to we need to make sure her back is flat. No arching here, okay? Just make sure. Now, this may hurt someone's knee, so I'll say, why don't you grab there? There you go, good. That way she's not compressing her patellofemoral joint. Always we're thinking about trying to not create pain. So where is Justine tight? Call it out. Iliopsoas, because she's not parallel with the table, correct? What about her rectus femoris, her knee flexion? Is she tight there too? Yes. She needs to be here. Okay, relax. You all right? Okay. If she's tight through here, it's going to cause her to be more anteriorly tilted in the pelvis, which will cause her spine to go more in extension, right, and create back pain, potentially. So this is a great test. Now, can you move around this way, you think? Okay. And if not, I can turn her a little bit, too. Let me try to turn her? That's okay. Okay, so this is also the test for the IT band, remember? So I'm gonna so here she is. Do you see where she is relative to the rest? Now, she should be here. Can you guys see that? But she's, I know I'm making you worse than you are, but yeah, no, she's not, no, you are. Her IT band is tight there too, okay? So, I was going to say you kill 3 birds with 1 stone, but have you guys heard on NPR that this is not right for us to take animals and put them in this type of discussion that we used to? These are all phrases that we learned when we were young. So we fried 3.
Hatch 2 birds with 1 egg.
Hatch 3 birds with 1 egg. Wow, that's not, yeah, something like that. Okay, good. Okay, switch. And then we're going to pull this one down. So, okay, so her IT band's tight on this side too, and you can see it here, right? So look how she's externally rotated and abducted. You guys can see that, right? And she's also tight, hip flexion here, and the rectus on this side as well. Okay? Why do I do that simple test? I do this simple test because I think it's so important for patients to walk out of your exam room knowing that there's a couple things that they can work on. Okay? Now, here we are. We're going to talk about you. No. I think that's it. I mean, essentially, do you guys want me to do it quickly?
Yeah.
Okay. We have time, right? Yep. Okay. See it. Okay, I'm going to try to ignore you. I'm going to pretend like I'm just talking to you, and that way I do my exam. All right. Hi. I'm Dr. Chang. It's so nice to meet you. Took a good look at your history, and we've done the history. Okay, and I'm here like this now. Okay, so I'm just going to examine you, and we'll see what's going on. Okay? All right, good. You let me know if you have any pain when you do any of this, or if there's anything that feels uncomfortable to you. Okay? Good. So I'm going to have you pull up your shorts a little bit. Thanks for changing. I appreciate that. Do you feel the same when I touch you here, 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 and here?
Yes.
Yeah, good. Okay, good. Pull up against my thumb. There you go, good. And now push down. Excellent, okay? I want you to kick out and pull back. Nice. How about on this side? Pull up, push down, kick out, and pull back. You know, you seem a little bit weak here, so let me do a little bit more testing, okay? So now push down on my hand. So I'm going to test S1 again, and this one too. Good. And then push out against my hand. This is L5, S1. These are nerve roots that come from your spine, and push out. Good. Okay, it feels pretty good, actually. Push out against my hands. Good. Lift this leg up. Don't let me push down. Lift this leg up. Don't let me push down. Good. All right, essentially. And again, you really haven't had any burning or tingling or anything down your leg. Is that correct? Okay. So now what I want you to do is to straighten your leg. Oh, that's a lot. And I want you to pull your toes towards your nose. Just like that. Drop your chin to your chest and lean forward for me. Any pain that shoots down the back of your leg?
Just a little tight.
Like a muscle tightness, like when, but nothing that feels like an electrical shock, right? Okay, no, how about on this side? And chin down to your chest and lean forward. How's that?
That's okay.
Not a problem? Good, excellent. Okay, would you mind lying down for me on your back? Oh, great. Okay, and relax for me. You know what? Scoot back a little bit higher for me. Now, I noticed that you had a previous history of maybe scoliosis when you were a kid. Okay. You know what? I'm just going to do something really quick. Okay, bend your knees for me. Lift up your buttocks. Come back down for me and relax. I just threw that in. That's my quick leg length check. You guys don't have to do that, but I just thought I'd throw it in. Okay, good. Let me know if there's any pain down the back of your legs.
Right about there.
Oh, there is pain. How far does it go?
It's mostly behind my knee and up here.
Okay, all right. So let me just do something. If I lower it, does that pain go away?
Yes.
If I do that, does it come back?
Yes.
Okay. You're not supposed to say that, but that's okay. No worries, no worries. No, it's okay. No, it's okay. No, it's good. It's good. Okay, good. Let me come over to this side. And any pain down your leg at all? You have really good flexibility. I'm going to check your popliteal angle this way too. And this is where I'm just going to have you keep this still.
Okay.
And I'm going to straighten your leg, and you let me do it.
Oh, okay.
All right, and I'm going to stop when it, okay. So your hamstrings this popliteal angle is about 145 degrees, okay? We could get a little bit better, all right? So we'll try to work on your flexibility as well. Okay, good. All right, good. No pain in your hip when I do that?
Oh, no.
No? Okay, good. Do me a favor and line your stomach for me. Good. All right. You let me know if you have any pain when I do this. Any pain down your leg or any pain in your back? No? Okay. No, she's going to be closer to me, but I didn't do it. Any pain in your leg or your back? No? Now push up like you're watching TV or up on your shoulders, elbows. You okay doing that? Good. And relax back down for me. Now, if I'm pushing here, do you have any pain as I push? So I'm pushing down the middle of your spine, Justine, either side of your spine, okay? Along the muscles along your spine, no pain. Along these joints called the SI joints, and then this is the area where your nerve roots come down. Nothing like that, right? If I was worried, I would do her reflexes. So go ahead and turn, and then we would do this. And I would do her hamstring reflex, and I'd have turn and do the other side as well. Okay, good. So now do me a favor, and I'm going to have you flip, and now move your bottom all the way down to the end of the bed. Keep coming, keep coming, keep coming. Good. Now, good. Now lie down and hug your knees to your chest, and let this leg drop, and relax. Just make sure your back is flat. Okay, you're a little bit tight here in your hip flexor, and the muscles that come down the front of your thigh, okay? And this band called the IT band, if you've ever heard of that before. And sometimes having that tightness can create low back pain. So we're going to kind of look into that. And this one is actually worse, Justine. So we're gonna hey guys, take a look at this. Let me get out of the way. So, sorry, I just involved the audience again. So when I try to straighten, I try to point this out. When I try to straighten her out, look how much her knee extends. Do you guys see that? So she's got this flexion here, right? When I try to look how that extends there. See what I mean? So she's a lot tighter than you would think. It's just that when she abducts like that, she has a little bit more flexion in that position. Okay, sit up for me. And do me a favor and turn that way in front of the camera. Okay, and so again, the reflexes, easy to do here, right? Little tricks, because it's really sometimes hard to get it in kids because they're just so interested in seeing what you're doing, is I always pull apart, look to the right, spell California backwards. A-I-N. And I totally distract them, and then I can get the reflexes better. Okay, good. And by the time they get to F, I'm done. So, okay, and now step down for me. Good. And turn to face the podium. So do you mind if I pull up your shirt? And I'm just going to tuck it right under your bra here. Good. So if you're comfortable at any time, please let me know, okay? Bend over and touch your toes for me. Good. Yeah, your spine's pretty straight. So I know that you may have been told you had scoliosis, but I don't get a sense of that today. Lean backwards towards me. Good. And lean to the right. Lean to the left. Excellent. Now rotate to the right. You're going to turn and then lean backwards towards me. And rotate to the left and lean backwards towards me. Any pain at all when you do that?
Am I supposed to say yes or no?
Oh, it doesn't matter.
Okay.
I'm just asking a question. Okay. All right, good. And then put all your weight on your left leg and lean backwards towards me. And put all the weight on your right leg and lean backwards towards me. Now, you know why this is so artificial, guys, is because, left knee up like you're marching, is because I haven't told you anything about her history, right? Right knee up like you're marching, because you wouldn't have to do all these things, but your history points you to what you're going to do. Your history points you to how much you're going to do about this. Walk away from me on your toes. So your exam could be half as long. Turn around. But you have to know the right, on your heels, you have to know the right things to ask, or else you're going to have a long history. But if you know the right things to ask and what you want to focus on, you don't have to do everything. And the only last thing I'm going to tell you is sometimes if I'm worried about weakness or anything like that, I'll have her do functional testing, where I'm going to have my patient do heel raises. And if I'm worried about radicular pain or some pain down her left leg, I may have her do heel raises on her right. Go as many as you can before you feel tired. You feel like your leg's going to cramp. Let's say she goes to 15. She turns around, and then she does it on the affected side, and she can do 7. Well, there's something going on there then, right, with the nerve firing with her calf muscle. And that's it. It's a simple thing if you know what if you know what you're looking for, okay?